being recorded for administrative purposes only. So we've got that started for you today, and I'm going to turn it over now. Have a great session.
Thank you, Beth. Good morning, everyone. Rebecca, I think we can go ahead and jump into the first slide. We are really pleased that all of you were able to join us today for this stakeholder meeting. We're excited to provide information about the new FAMUS prenatal coverage. In case you haven't heard the name yet, that's what we're going with, FAMUS prenatal coverage. Sometimes you'll hear us say FAMUS PC. It will be available on July the 1st, and we look forward to addressing all of your questions today and getting your input on how we can be successful in connecting newly eligible pregnant individuals with this critical coverage as early in their pregnancies as possible. So FAMUS PC was created through an amendment in the 2021 Special Session 1 budget that was passed by the General Assembly and signed by the Governor in April. And since that time, we've been scrambling at DMAS, collaborating with our DSS partners, and working to ensure that this coverage is going to be up and running on July 1st. And this is really because we know what a difference it's going to make in the health and the lives of these newly eligible individuals to now be able to receive this comprehensive prenatal care that was previously not accessible or affordable for them. This new coverage is a really important step forward in Virginia for advancing both the health equity goals and the maternal health goals of the administration and Virginia Medicaid. And as you know, this coverage is going to build upon the recent removal of the 40 quarters work requirement. If you don't remember, that was effective on April the 1st with an additional expansion of affordable quality health coverage to Virginia's immigrant communities. As you may know, the 40 quarters work requirement, although it did not apply to pregnant women and children, it was a requirement that legal permanent residents or green card holders had to have 40 work quarters, essentially 10 years of working in the U.S. in order to qualify for Medicaid. That requirement is now no longer in place, and LPRs are eligible for Medicaid if they have 5 years residency and meet other eligibility criteria. In Virginia, pregnant women and children who are lawfully residing have long been exempt from both the 5-year residency requirement and the 40 quarters requirement. Since 2012, pregnant women and children do not have to be green card holders or meet other immigration status requirements to qualify, except for the lawfully residing requirement. However, a coverage gap has continued for individuals who do not meet lawfully residing status. FAMUS Prenatal is going to be a step forward that helps us to close that gap for these Virginians during a critical time in their lives and the lives of their families during the pregnancy and birth of a baby. And it's now going to allow them this comprehensive prenatal coverage that will also include coverage of birth and 60 days postpartum. We're really excited about this opportunity to advance the governor's goal of eliminating racial and ethnic disparities in maternal mortality by 2025, and to deepen our agency's commitment to promoting health equity in Virginia, improving maternal and infant health outcomes, and delivering high-quality, affordable care to our members. Next, I think I'll be turning this over to Hope, and she's going to provide everyone with an overview of the new coverage. Thank you again for joining us today.
Thank you, Sarah, and thank you everyone for joining us today. My name is Hope Richardson. I'm a Senior Policy Analyst here at DMAS in our Division of Policy Research and Member Engagement. And so I'm going to give you a bit of an overview of the new FAMUS prenatal coverage. And then we have Cindy Olson, Director of our Eligibility and Enrollment Services Division here to provide some information about eligibility and enrollment processes. And then finally, we will have Rebecca Dooley, Strategic Communications Manager, to tell you a little bit more about our plans for communication and outreach. And then after that, we'll open it up for your questions and input. We do have a very large call today, so we're asking you to submit questions through the chat feature when we get to that point. And we will get to as many of those questions as we can in the hour that we have today. We are also working on planning probably another post-implementation stakeholder meeting. So if you still have questions after the end of the call today, or if questions arise as the new coverage is rolling out, there will be other opportunities for you to connect with our DMAS team and discuss your questions and concerns. So effective July 1st, there will be a new FAMUS prenatal coverage option for pregnant individuals who meet all other eligibility status criteria, but until now have been ineligible for full benefit Medicaid because they don't meet immigration status criteria. The recent budget that was signed in April contained an amendment that enabled Virginia to adopt a federal CHIP provision that's already in effect in 17 other states, which allows for prenatal coverage of a mother when their child is expected to be eligible for CHIP or Medicaid at birth. We're calling, in Virginia, as Sarah mentioned, we are calling this new coverage Famous Prenatal. And with this new program, uninsured pregnant individuals who otherwise meet eligibility criteria for Famous Moms or Medicaid pregnant women, regardless of their immigration status, will be able to enroll when they learn that they're pregnant, and they will be able to receive comprehensive coverage during the prenatal period, through labor and delivery, and then through 60 days postpartum. These are the individuals who do not meet criteria to qualify as lawfully residing pregnant person. So this is mostly a population that will be undocumented individuals and DACA recipients, dreamers. Some of these folks currently qualify for emergency Medicaid coverage of labor and delivery, but otherwise these individuals have previously been ineligible. For the new coverage, the income ceiling will be the same as for Famous Moms, so it will extend up to 205% of the federal poverty limit. And let's see, let's go to the next slide here, Rebecca, please. So this is a population that we're currently not seeing in managed care. We're mainly seeing, to the extent that we are seeing this population, we're seeing them in emergency Medicaid, which is fee-for-service. So this will be a new opportunity for managed care enrollment for this population, and they will be newly enrolling in coverage with our 6 plans. The Famous Prenatal group is a CHIP population, so they'll be enrolled in managed care in our Medallion 4.0 program, which serves the majority of our pregnant members today. And they'll be receiving the Famous Moms benefit package. So that means comprehensive coverage that's not limited to pregnancy-related only benefits. And as with our other pregnant populations, there will be no cost sharing for Famous Prenatal members. And we're also providing the same postpartum coverage that we provide for our other pregnant members as well. So that coverage will continue through the end of the month in which the 60th postpartum day falls. Next slide, please. So to outline some of those covered benefits and give you a sense of the benefit package, all regular prenatal care is covered, including checkups, labs and testing, screenings that a person's doctor might recommend. Labor and delivery and the hospital stay are covered. Any other health concerns that arise during the coverage period that are not directly pregnancy related, those are covered. Everything from a sprained ankle to an existing health condition that the pregnant person might be dealing with that preceded the pregnancy. Prescriptions are covered, and the Famous Prenatal enrollees will also receive the Pregnant Women's Dental coverage, which is a very robust benefit that we offer to our pregnant populations. And then, of course, also behavioral health screening and treatment, which that would include prenatal or postpartum depression and anxiety screenings, or if the member wanted help quitting smoking or addressing a substance use disorder during their enrollment period, those would be covered. And then now I'm going to pass the ball over to Cindy Olson, and she will give us a little bit more information about eligibility and enrollment for our Famous Prenatal with our next slide here.
Good afternoon, everyone. Just like our Famous Moms eligibility criteria, to be eligible for coverage in the Famous Prenatal, the pregnant person must provide the estimated delivery date and the number of children that are being expected. There is no requirement to provide documentation. This is done by self-attestation only. The individual must live in Virginia, must meet the income rules, and as Hope said earlier, up to 205% of the federal poverty level. If you're a DSS person and you're on this call, The poverty limit is 200% of poverty plus the 5% income disregard that we allow, and the individual must be uninsured. The rest of the eligibility requirements for famous moms are followed. The eligibility determination is completed in the same way as the famous moms eligibility determination is completed. The applications will be processed within 7 days, just like other applications for pregnant women. Next slide, please. Most of the infants born to individuals enrolled in famous prenatal coverage will be eligible for ongoing coverage. However, the babies that are born to individuals enrolled in this group are not deemed newborns like we would see in famous moms or Medicaid for pregnant women. That's because we are, under the federal definition, covering the unborn child for the coverage period and not the mother. The mother is receiving her coverage based on the fact that she is carrying this baby that we're covering. So newborn deeming does not occur for infants who are born to individuals enrolled in this group and who are in managed care. However, there is no need for a new application for coverage to be submitted for the infant. We are treating this as a change in circumstances, and the birth of the baby needs to be reported in the same manner as it's currently done, either through Cover Virginia, the local Department of Social Services, through the hospital E213 process, so that the baby can be added. Coverage under Mom's Medallion 4.0 plan for the birth month +2 will continue so that we can ensure that the infant will have access until the eligibility evaluation has been completed. Hospitals should continue to follow their existing processes and report the birth of the child in the same manner as is currently done today for other Medicaid and Famous Moms members. And then Cover Virginia and the local agency workers will complete the evaluation and reach out if any additional information is needed to complete that evaluation. We see this as a good way to make sure that we're going to get these babies covered, and for local departments of social services, staff who are on this call, we are in the process of finalizing a training slide deck and desk tool for you to use. We will be doing train-the-trainer session with State Department of Social Services, home office, and regional practice consultants, and then that information will be rolled out to you. And I think I am turning it over now to Rebecca.
Hi, everyone. Thanks again for joining us during your lunchtime. We're, as everyone has said, very excited about this new coverage opportunity for parents and children. A little bit about communications and outreach strategies, how we plan to get the word out about this new change. So, of course, we're having a stakeholder meeting with you all. And as some folks have already mentioned, we plan to do an update in July to talk about how implementation is going, what are we seeing, what are you all seeing, and how can we continue to move forward and ensure that everyone who is eligible gets coverage. We will also be doing digital communications. DMAS, when you go to our websites, either the dmas.virginia.gov or coverva.org, you will get a pop-up that asks if you want to get updates about Virginia Medicaid. If you're not already on that list, which you probably are because you may have gotten the email invite from that email, but if you're not already on the list, I encourage you to join, and that is where we send out all of the latest information for stakeholders We also do a lot of member communications as well. So we will be doing a member update for all folks who have signed up to receive information about Virginia Medicaid coverage. We will also be submitting a press release. You should see that hit around July 1 when the start of the coverage begins. We'll be using our social media. DMAS has a Cover Virginia Facebook page, a famous Facebook page, Cover Virginia Instagram, Cover Virginia Twitter, and our director, Karen Kimsey, also has her own Twitter account. So we will be using all of those to get the word out as well. We'll also be recording this webinar and posting it on our YouTube channel. So you can see it there after. We'll send out a follow-up after this webinar is over. Of course, continued stakeholder engagement. We are always wanting to hear from our stakeholders because we know that you all on this call are often the people interacting with Virginians face-to-face or maybe screen-to-screen in these days. And we want to hear from your perspective, what's working, what's not working, what can we do better, how can we support you all, and then how can you support us? I'm sure there are communities out there that need to know about this coverage, and you probably know them better than we do. So we're really looking forward to working with all of you to continue to implement this and 40 quarters and ensure that folks who don't have coverage right now can get it in the coming months. And I believe this follow-up conversation for post-implementation will be in July. We'll send out an invite in similar manner then you got this one. That is all for me. So I'm going to go to the last slide, which is just asking if there are any questions. So I know my team is monitoring the chat. I'm also going to take a peek and we can go ahead and start to respond.
Rebecca, I do see a question there about the state residency requirement. That's, excuse me, actually a requirement for, I believe, all applicants. Cindy, if you are still on, maybe you can address documentation requirements, if any, for state residency.
Sure. There is state residency is done by self-attestation unless it's questionable. So we do not today ask an individual to provide documentation of being a Virginia resident. You state on your application that you are a resident of Virginia, and unless something comes back and the eligibility worker finds it to be questionable, we do not request documentation.
I also see a question here regarding whether there will be tip sheets or whether we'll be circulating this PowerPoint. I know, so if it would be helpful, I think that we could share the PowerPoint in addition to the recording of this webinar. Rebecca has spoken a little bit about some of the materials that we'll be putting out. We are also trying to put together a survey to follow up this webinar to send out to you all as stakeholders to get a sense of any additional materials that would be helpful, what types of things you'd like to see as you work with this community in your daily work, you know, what type of outreach would be, you feel would be most impactful. Rebecca, did you want to add anything to that? Seeing also a lot of, or seeing a question here about whether we will be providing translated materials into Spanish. Rebecca, the answer to that is yes. I don't know if we have more detail to provide right now. I think Rebecca's screen might be frozen. Can you hear me? Okay. Um,
Hi, Hope. This is Beth.
hey.
I just want to remind the panel that there's also questions that are coming in, not just in the chat, but in the Q&A as well. So
Oh,
I just
okay.
wanted to let you know, and if you don't have it immediately on your screen, just go down to the lower right and click on the 3 dots, and that will open up the Q&A.
Okay.
And I'll reach out to Rebecca and see if I can help her.
Yeah, I wasn't sure. I can't tell if folks are hearing me or if Rebecca can hear me.
You're coming through loud and clear.
Okay, good. So yes, we will be doing our best to provide as many of these materials as possible in Spanish. We know that I believe that is the largest language that's spoken by this population. So we understand the importance of that Spanish language outreach. And there's a very good question here. Will there be any fact sheets or information on this coverage being an exempted program under public charge? The public charge rule, I think most of you all are probably familiar. It has been rescinded. It's no longer in effect, and this wouldn't have applied before that, and it doesn't apply today. And so I agree it's important for us to get the word about that out for a number of our populations and types of coverage. So I think that that may be a broader messaging question, but this would be something that we would definitely welcome your input if you think that that it would be helpful for us to include a line about that on materials that we're putting out there. I think that we need to be sort of cautious about, we don't want to raise a specter of a concern if it's not there. But if folks feel that there's really just still a lot of hesitancy to enroll in Medicaid programs because of that fear of the public charge rule applying to them, then that's something that we can look into. Okay, I see that Rebecca had to drop off because there was some audio noise on her end. Okay, so someone is asking, will emergency services for labor and delivery be going away? Or is the famous prenatal coverage if they apply prior to the birth and emergency services if they apply after? Since I believe there's no retro coverage for famous prenatal coverage, correct? So I guess I'll take this one piece at a time, and I think Cindy may also want to fill in some gaps for me here. But emergency services for labor and delivery will not go away entirely. For our individuals who are enrolled in this program in managed care, they'll be getting their labor and delivery through Famous Prenatal. There will be individuals who do not enroll in this coverage or who don't enroll until during or after their hospital stay for labor and delivery. And for anyone who enrolls in the month of the birth, the way that our systems work, their coverage in Famous Prenatal will go back to the beginning of that month. However, if an individual applies and the month has already passed in which the birth occurs, then they would only be able to be, or the evaluation would be done, and they would only be potentially eligible for emergency Medicaid, because that's correct. Our typical retroactive coverage of several months would not apply for Famous Prenatal. So they would potentially be eligible for emergency services coverage of the birth with that retroactive eligibility. Cindy, do you have anything to add to that?
No, you're exactly right. Because there is no retroactive coverage for this famous prenatal coverage group, individuals who do not apply for coverage until after the baby is born. Currently women sometimes wait until the month after the baby's born. A lot of them apply while they're in the hospital, but if they wait until after the month after the baby is born, then only an emergency services evaluation can be completed.
Let's see, we have oh, sorry?
That's okay. This is Rebecca. Sorry, I lost you for a minute there. There is a lot of sudden construction happening in the apartment above me. The joys of working from home. But I'm seeing in the chat a lot of people are asking for the difference between postpartum coverage for this covered group versus others, and kind of a look ahead. A lot of folks know that Virginia has been looking at postpartum coverage for up to 1 year, and so I was wondering maybe you might be able to clarify some of that for us.
Yes. So with in the documents that we're filing with the Centers for Medicare and Medicaid Services to authorize this option federally, we are requesting the 60 days postpartum that is possible for this population. Unfortunately, there's no state precedent or other really vehicle to provide postpartum coverage for undocumented populations beyond that 60 days. There's just and to receive federal financial participation for that, Medicaid match essentially. So at this time, and also based on the state budget authority that we have to seek permission to provide this coverage, we really only have the ability to create the 60 days postpartum coverage. And meanwhile, we are applying for the famous moms population that currently those folks at 60 days, they typically don't qualify for Medicaid expansion, so they can't sort of move into another coverage group. So we have filed an 1115 waiver application for that population to provide an extension of the postpartum coverage to 12 months, but that applies to famous moms only, not to this new coverage group, simply because there does seem to be a route opening up only very recently to provide that coverage for some CHIP pregnant groups, but again, we have not seen a state precedent or according to the guidance we've received from the federal government, really a route to being able to extend postpartum coverage or anything besides really this core maternity coverage for this group for longer than 60 days postpartum. There would be the option of doing this with state-only funds, but that would require GA action, General Assembly action. I'm kind of, oh, sorry, I'm sorry, my screen is just flickered out. I'm trying to sort of go through these Q&As and pull some here and there. I don't think we're going to make it through them all, so please know that you can feel free to contact us after the webinar, and we will do our best to address your questions with you. But I do see a question here about the processing time for these applications. I wonder if, Cindy, if you can address that. Someone says, did you say that applications have to be processed within 7 days or 10 days?
So application processing time for pregnant women applications changed maybe more than a year ago, and we moved it from 10 days to 7 days. So all pregnant women applications are supposed to be processed within 7 days.
Okay. Someone asks, excuse me, occasionally a patient will have a sonogram prior to their first prenatal visit. Would this be covered? Are pregnancy tests covered? So the answer to that would be that when the individual applies, their coverage would be effective the first of the month in which they apply. So, you know, if they applied on July 15th, and that sonogram was on the 14th, then I think that it would be covered because they would be enrolled for that month. But it would not be retroactive to before that month. if I understand correctly. Cindy, if you could verify that, that would be helpful.
Hope, can you repeat that, please?
So the question, the question was, occasionally a patient will have a sonogram prior to their first prenatal visit. Would this be covered? Are pregnancy tests covered? Actually, reading this again, it's occurring to me that I think there's a question of whether the individual is pregnant. So if potentially they were found not to be pregnant, in that case, it would not be covered because the pregnancy is the attestation of the pregnancy is part of the requirements to meet this eligibility group. But if any sonogram before the pregnancy was confirmed happened in the month that the individual enrolled, I believe it would be covered. But Cindy, I'm deferring to you.
No, you're correct, because eligibility will always go back to the first day of the month of application. Since there's no retro coverage, the earliest day to begin coverage would be the first day of the month of application. So if the sonogram happened, let's say on the 10th of the month, and the individual filed her application after that point in time, then coverage would go back to the beginning of whatever month that she applied. And as long as what she received was covered service, then Medicaid would pay.
Okay. And I apologize if I'm not going through these questions in perfect order. They're very small on my screen, so I'm kind of hopping around a little bit. There's another question about what the newborn's AC code is. And I'd like to clarify here just that the newborns, they would have the same AC codes as they ordinarily would. They don't have a special code. They're going to be enrolling in the same groups that they would have before. So we have our famous newborns and we have our Medicaid newborns, and those AC codes would not change. They will be tied to, that would be sort of determined based on what category the mother is in. And the mother's AC codes in VACMS will be 110 and 111. And then 110 is that Medicaid range, that's currently eligible for emergency Medicaid in some instances of L&D. And then 111 maps more to the famous moms eligibility range for the mother and to famous eligibility for the newborn. We have a suggestion here for an FAQ. I think that is a great idea. So that others can, as we go back and try to comb through these questions after the webinar, others can kind of benefit from the answers as well as the question asker. And thank you, Rebecca, for monitoring. There's a few questions, a few answers, a few responses coming through on the Q&A.
Yes, I'm trying to get the ones that I know the answers to. Several people have asked about Spanish language. We will have all of the outreach on this new coverage translated into Spanish. You can find that later this month on our Cubre, Virginia website. I will add that in the chat for everybody. As well as people are asking about the phone number to call and submit applications. I will put the phone number in the chat as well, and I will also put all of our website addresses.
Rebecca, if you see any that you'd like me to tackle, let me know. I'm still scrolling through. Okay. Will this new category have coverage after the 60 days during the COVID-19 pandemic as pregnant women with legal status currently have? So for our famous moms, for that income eligibility range, and just for our CHIP populations in general, for individuals who are going past their 60 days and also for kids who are aging out, The guidance from the federal government has been that we do have to redetermine those individuals, and if they are not found eligible to meet another coverage group, that they are not continuing with coverage. So this is also a CHIP eligibility group, and so for this group, they would not receive additional months of coverage. But just to clarify that that's also the case for Famous Moms at this time, and also for our individuals who are legally residing, pregnant women, what we sometimes call our CHIPRA 214s. Those individuals at 60 days are also timing off of coverage if they don't meet another coverage group. Sorry,
So
still
there
kind
are
of.
quite a few questions, or a couple of questions on how would self-attestation work if folks are paid in cash, and or what identification could be used if someone does not have a social security number, other forms of ID. So I don't know if we have the answers to those right now, but if not, maybe we can point people in a direction. You know, that might be something we put on the FAQ sheet that goes on the website at the end of the month.
Yeah, I would say Cindy, unless you have something to add there, I mean, I do think some of that might work similarly to how it works currently for emergency Medicaid.
Someone asked, and this might be, again, a question for Cindy, if she's still on the line, but if we would still use the web portal to add newborns.
Providers, yes, can use the web portal to do the E213 process that we currently have in place. We are not changing any of those processes for adding newborns. They will be added just like babies are added today. So the mom can call Cover Virginia, the provider can go through the portal, can contact the local Department of Social Services to add the baby.
I think we've gotten similar questions to this a couple of times about whether there is coverage for lactation support postpartum. And really the response to that is that they truly do receive the same benefits as Famous Moms up through that 60 days postpartum. So they would receive that to the extent that that they're able to utilize it in that 60 days because they would have the same benefit package, but it would not extend beyond the 60 days postpartum. I'm seeing a couple of questions here that I think maybe are coming from local DSS. We have seen the question a lot regarding the sort of the household composition for eligibility. I think that we will tackle this separately and specific guidance to LDSS. But just Cindy, for awareness, there's a question here. Say the mother applies on her own and is not legally married and gets Famous prenatal coverage, then we're treating adding the baby as a change and we don't have father's income on file, but he's there in the home. Do we need to ask if the father's in the home and their income to properly evaluate the baby since they aren't deemed? We have been getting some questions in that area, and rest assured that we will get more information out to you just to clarify that. Cindy, if you want to speak to any of that now.
I was just going to say all of that information is included in the training slide deck that we are finalizing now for VDSS and the local agencies. So stay tuned.
Rebecca may have already covered this, but someone asks where this WebEx will be found. I think that we have the ability to send the link out to everyone that's on this invite, so we'll do that at least, and then I'm not sure where it'll end up residing, on the YouTube channel. I don't know if we'll have it on the website as well, but we will send this out to anyone who is on our invite. So if you're joining but you are not officially on the calendar invite and you would like to receive it, I will put my email in the chat here, in the Q&A here. You can shoot me an email and I'll make sure that gets sent, you get added to that list to receive the recording of the webinar.
So I think we've hit on most of the themes of all of the questions. And so if anyone has any further last-minute thoughts, we'd love to hear it now. But I do want to also give you all a bit of time back. I know we're all busy and this is lunchtime. It's very valuable. So we'll take any last-minute thoughts or questions, and we do have a record of the Q&A, so if we missed any, we will be sure to address it in the follow-up email sent to everyone. So we've had twice someone ask about MCH home visiting. I'm not sure if we have the answer to that right now.
Yeah, my response to that would be the same as it was with concerning lactation support. Basically, this group will receive the same benefits that Medicaid pregnant women and famous moms receive. I know that the home visiting benefit for managed care is still in development, and it is not available as of yet. It hasn't come online, but my understanding is that when it does, any benefits that are added, and would be included as part of the Medicaid pregnant women benefit package would also apply to this population, with the caveat that that their coverage will, for the foreseeable future, we would not be able to extend their coverage beyond 60 days postpartum for the mother. If the child was eligible and if there was some type of eligibility for the infant for home visiting, that would be another matter. But we would have to look at that specific circumstance to be able to comment on that. I see a question about contraception as well. There was recent legislation passed that extended the ability to receive a 12-month supply of oral contraception, and if the individual filled that prescription while they were, within their 60 days postpartum, that they had received a prescription from their provider, then they would be able to fill that prescription and for the 12 months, just like any other enrolled individual in Medicaid or FAMUS.
I think we
And
have a few people who maybe joined a little late, so I just wanted to reiterate that we will be sending out the slides, as well as updating our website with things like FAQs, fact sheets, things like that. All of that will happen by the end of the month as this coverage starts July 1.
I want to thank folks for their comments too and support of this initiative. And I see folks here that worked on the legislation and the budget amendment, and I'm sure that you all will really be following how this rolls out. We really appreciate your support and hope to keep working with you to make sure that this implements as smoothly as possible. We're getting a lot of questions about the benefits, and I think it probably will be a good idea for us to look at creating some type of an FAQ that would kind of address some of those broadly, but the general answer is that that the benefit package is the same. So if something is covered for famous moms, it would be covered for this group as well. We are also working to have the non-emergency medical transportation covered for this group as it is for famous moms. I would also say that I know there's some folks that I think that Rebecca addressed this already, and I'm sorry if I didn't catch all of your answer, Rebecca, but just the folks that are asking for, how to apply and that type of thing, all that information, with numbers to call and so on, and the steps to apply will be in our fact sheet that will be coming out, and that'll be available, I believe, in English as well as Spanish. Someone asked, is this coverage being offered for documented or undocumented applicants? Something that Sarah had mentioned at the top of the call, but I think it bears repeating, is that individuals who are legally residing in the United States, which is not limited just to green card holders, but other legal immigration statuses. Those who are pregnant women or children are already, if they meet other eligibility criteria, if they're in the income range to qualify for Medicaid or famous moms, and are state residents and so on, those individuals already today are able to receive coverage through our existing programs. So really, there has been a coverage gap for undocumented individuals, which includes DACA recipients, and that is what this new coverage is going to allow us the ability to offer. So famous prenatal specifically is going to be coming in and allowing for that additional coverage. It will be predominantly, we expect, undocumented individuals, while individuals who qualify that have legally residing status will continue to be enrolled in our existing groups, famous moms and Medicaid for pregnant women. Someone asks, what if they haven't met the criteria of having been a permanent resident for 5 years? Will they still qualify for coverage? And so this kind of relates to what I was just saying. So those lawfully residing pregnant women and children, today they are already exempt from the 5-year residency in the U.S. requirement. So they are not required to have been here in the U.S. for 5 years. They also have not been, since 2012, they haven't been required to have 40 quarters of work history. So this new coverage, really, it is predominantly going to be folks who did not meet the legally residing status, and they won't be required to be a legal permanent resident for 5 years. But just to clarify, our current pregnant populations aren't either. There's no cost sharing for this group. Someone asks about a copay for a maternity clinic. If it is a provider that is in their managed care plans network or in our Medicaid network, if they're in fee-for-service, then they will be able to show their card and receive all services without cost sharing. And I also see some suggestions about potential media opportunities. Again, I will share my contact information. Feel free to reach out to me if there are any comments in addition to questions. If you have any suggestions or comments, for us to keep in mind during implementation, please feel free to email me, and I will see that they get distributed to the right team to take a look into the issue and respond.
Well, we haven't had any new questions come in the last 5 minutes or so. So I think we could probably wrap it up.
I think so.
I really appreciate everyone's time and taking the opportunity to learn about this new coverage. These questions were great and definitely gave us some good ideas to add to our existing materials that we've been developing. So definitely keep an eye out for those. You can always reach us. I actually monitor the messages on our social media. So if you have trouble finding us, you can always shoot us a direct message on Twitter or Facebook, and it'll be my friendly face responding to you. So you can always reach us that way.
Thank you, everybody, for your time and for your questions, for your great participation, and we are really looking forward to working with all of you to make sure that this is successful as we roll it out.
This will end today's session and end the recording.